The topic I'm talking about this evening is quite dear to my heart because my one of my children has recently come out as trans, and that sort of prompted me to look more deeply at something I didn't really know much about before that, other than through my training, which is, typically it's limited to say one module and we learn a little bit about it. We maybe meet some people on the way, but we don't really know. So I wanted to get a real feeling for the lived experience of what it is to be trans and what it is to transition. And so really this is really about diving deep, not going broad, but looking at specific experiences and getting a real feel for what's really going on for somebody when they come out and transition. So in terms of why now, there's been quite a lot of, as you've probably seen in the press, quite a lot of stuff going on in the news. There's been quite a lot of recent talk about a lunch that J.K. Rowling had. There's quite a lot of radical, people are polarized. It can be really quite difficult to have a conversation because people feel so strongly. But it tends to often be in the area of trans women that the focus lies. There's not usually a lot of focus on trans men. Certainly in the research, when I was looking at what I would do for my research in this area, there's quite a lot of literature, but again, it doesn't really focus on trans men. It might include them, but it doesn't specifically separate out the two experiences, which actually, having looked at it now in more depth, that there is a huge difference between transitioning from male to female versus female to male, and what that brings up and what you might encounter as a result in the therapy space. So the other reason why I sort of chose this was because of my focus on the existential through my training at NSPC. And I wanted to look at something that really spoke to those themes of authenticity, truth, and the lifespan as a sort of pathway to empowerment, as I've called it in the title slide. So when I was looking at what I could do, I sort of thought, actually this fits really well. And so in terms of existential themes, there are all sorts of ways that philosophical existential thinking aligns with, or potentially aligns with, the trans experience. There's this concept of the living in bad faith aspect of, you're born, you come into awareness and grow up within a family system, but something isn't right. There's a dissonance. You're not really living your truth. You're not living authentically as you, and how that actually then comes out, manifests in the world, and goes from the inner to the outer. So it touches all of the existential dimensions really in a very, very deep way. So there's this theme, as I've alluded to, the truth and authenticity aspect, Heidegger's concept of the no self. So this idea of us living authentically, and really, if you're trans and you haven't come out, there's an aspect of inauthenticity there, that you may be living, but you're not fully alive. You're not really aligned with your true life's path, and it's not something that you can really just live with. Often it becomes something that you have to do something about. And so that's a very, I think for me, there was something there about this being really powerful, because it's not just a choice. It's not, oh, I would like to have a child or something like that. Maybe I'll get married or whatever, I'll change career. It's actually often even a case of life or death. It can lead to profound shifts in a person's psyche in terms of coming out as transgender. And then there's the aspect of embodiment, Merleau-Ponty's framework. And it's very interesting to me, looking at and in my research, talking to the interviews, how the route, the pathway to empowerment seems to be very much through the body, through the physical transition, that then enables the person who's undergoing that to express themselves fully in the world. And so it's a very physical, inner to outer dynamic. which I find quite interesting. And there's also a temporal aspect in the sense that transition isn't just one event. It doesn't just, you don't just wake up and transition. It's a slow process of change. So there's a real temporal quality to it. And then lastly, just this movement towards freedom. So the pathway to empowerment in the sense of Emmy van Deurzen, this is a quote from her: "In us, what seemed necessary and determined becomes free. We are the place where transcendence manifests." So in all of the interviews and in general, it seems that just there's this kernel of knowing that then grows and manifests, and there's this transcendental aspect of moving towards the authentic self, becoming or being, but showing oneself in across the dimensions in the external world, in the social world. So that was really interesting for me. So then moving on, just looking at gender identity in terms of the sense of self, if we start with the self before a person has realized they're trans or before they've come out, there's this concept of gender identity. What is it? So I sort of researched this a little bit, because we don't often think about, well, what is my identity? What does it actually mean? And so here we have a sort of a definition: an individual's sense of their own gender and connection with a particular gender identity label, such as man, woman, transgender, other non-binary gender identities. So there's this aspect of, okay, it's something, but what does that mean for the individual? What does that mean? Because it's very easy to get caught up in labels or caricature or sort of what say the press might tell us this means, but actually I want to sort of dive more deeply and look at what this really meant. And part of this was really just thinking, well, okay, how many people are there who are trans? You know, how many people are, I don't know if any of you have worked with trans people or do work with them, or non-binary. Certainly in my practice, I'm seeing more and more young people in particular coming forwards who've either come out or are identifying as non-binary, or it seems to be more prevalent. So the numbers, actually, I was amazed to see that actually we don't really know how many people are trans. So it's really quite incredible. So I looked at what was known and available, and there's a sort of estimate that it could be 65,000 people, ranging up to 300,000. So that's quite broad. And this is from the ONS and JIRES. So these are trusted sources. They're not just sort of, this is the best we can really go to in the UK. So this is a population around the size of Cardiff. And sometimes you get the impression that sort of trans people are sort of taking over the world, and that sort of from the press that there's this terrible sort of oppressive force of all these trans people just exploding all over the place. But it's not really like that at all. Actually, the numbers are quite low, but they are growing, and they're growing more and more in the terms of younger people coming out, adolescents, people in their 20s. And there's part of the reason for that is that there's not much more availability, there's much more knowledge, there's more availability of hormones, there's more developed surgeries available. So it's a very different picture to how it was even in the 90s or the early 2000s. So where we're at right now is we just had the census in 2021, and in the summer we should get the results of groundbreakingly this one question which was asked: is the gender you identify with different from your sex registered at birth? So that's literally it. So we won't really even then know much about the different sort of types or how it, you know, won't know a lot more than that, but at least it's a start. But sort of alongside that, in the real world, this sort of number of referrals is growing at a pace, and so the incidence was estimated at 3 per 100,000. Excuse me, but there's been a growth trend from 1998 of 11% per annum, which is doubling every 6.5 years. So there's something going on here. There's definitely a big growth, and that's sort of borne out here. So this is the fig table on the right is quite old, but it's, again, there's not a lot of data out there. But you can see the growth rate on the right with from 2009 to 2015 in terms of number of referrals. This on the left is the current, as of 2 days ago, numbers from the gender identity clinic, sort of summary picture, the snapshot picture of where they're at. And so they've got 10,648 people on their waiting list. And they're offering total appointments of about just under 1,000 a month. So there's a big waiting list, and some people have to wait. So it says here they're currently offering first appointments to people who were referred in December 2017. So this is where there's this gap. There are people who are being referred, they're going to their GP, they're being referred, but then they have this big wait. And so sometimes they end up coming to us, looking for help and support. And this is, I think, where there's a big gap that needs to be filled. So yeah, 25-fold increase in the last decade. It's big numbers. And these people need support. So one of the things I really wanted to do with this presentation was just highlight the human aspect, that these are real people, and they often struggle with all sorts of things. And I've seen it with my own child, just the coming out, the naming it, verbalizing what's going on, it can be really challenging, let alone the rest of it. So just looking at this sort of breakdown, so there was a national survey on experiences of LGBT in the community published in 2019, and this was the rough breakdown. So trans men are definitely in the minority. It's not to say that these figures are absolutely 100%, because it was self-respondent, so it may not be truly representative, but it gives a snapshot. So another reason to focus on trans men and give them more of a voice. So then looking at the gender identity clinics, this is just a snapshot of waiting times for first appointments, and you can see that it's not insignificant. So then we start to move to, okay, so we've got all these people asking for referrals, the numbers are going up. What's going on with life satisfaction? How do they compare to the UK population? And this is again taken from the ONS survey that was done a number of years ago. And life satisfaction is not great for trans women, non-binary, trans men. It's definitely lower than in the UK population, and that this starts to give us a bit of a picture of what's really going on. So in terms of what the participants in that survey spoke about, they talked about being ashamed of holding each other's hands, having incidents of violence, verbal harassment, that kind of thing, conversion therapy, attempts to cure them, lots of people not really understanding what's going on for them. And also quite a high incidence, 24% of respondents accessing mental health services. And I should say all of the people I interviewed, although they're in a good place and living really good lives, they've all been through a route which has involved accessing mental health care to varying degrees. And this is just a snapshot from HuffPost of the sort of thing that goes on. So inpatient in mental health units at least once, being refused care, finding it very difficult to go to their GP because the approach of individual GPs can differ, and some are quite supportive, others not so much. Very difficult sometimes to live openly because they might be fearing losing their job, that kind of thing. So this all just adds to a bit of a picture of this is not something you just choose to do on a whim. It's a real, it's real, you know, it's about I'm choosing to live authentically in a way that works for me, but that means that I'm going to have to navigate all these challenges in my social life, in my personal life, in my career potentially, and how is that going to be, and what factors will support me in moving through that. So you know, this is quite a big slide, really, isn't it? Just looking at, you know, suicide attempts, thoughts of suicide, diagnosed with depression. These are real real numbers, and they bring it home. I think, you know, this is actually something that for trans people, it's real that they do encounter a lot of challenges. But at the same time, this is also a route to living authentically and living their truth. And lots of people are going through this, and increasingly it's a pathway that is more well trodden and well known, and there's more and more information out there that people can access. There's information on the internet. There are more and more qualified therapists, and I think having more qualified therapists, or people who are cis, who aren't actually in the community but know and really understand and can offer support, is really crucial. I've certainly really struggled to find qualified, capable therapists for my child, just from looking around. And I'm in South Oxfordshire, you'd think there'd be lots, but there aren't. It's quite challenging. So then I just thought, just a quick sort of light-hearted just look at, in the press, there's sort of, and some of communication, it's like, oh, well, you can always tell, but can you? If you looked at these pictures, I wonder how many people you would identify as being trans. And we've got Caitlyn Jenner there, who's obvious. But I don't know about you, but a lot of the others, I can't pick out which are trans and which aren't. Actually, really not at all. And this is the thing, you can't really tell often, particularly with trans men, because they blend in very easily, often, because they are just sort of I think because women can dress in trousers already, and they can be more masculine, it's sort of somehow easier to just go that next step. So they talked in my interviews, they talked about passing and how important that was. But looking at these slides, actually everybody is trans here, everybody. And actually they're all ages, and they're from all sorts of backgrounds, and they all look amazing, and they're all human beings. And I think that's the most important message here, is they're actually all people who are putting themselves out there and living their authentic lives and expressing themselves, and that's fantastic and to be celebrated. So I also thought it would be worth just saying, well, this isn't a new thing. This isn't just started now or 5 years ago. So this is Billy Tipton, who was a jazz musician who had 3 wives and I think adopted 3 children, and managed to conceal their identity as being born female until they died. And then their wife at the time was shocked to find that they weren't married to a man. But they managed to keep this hidden, but they lived fully as them from 1914 to 1989. So quite early on, really, before people really even knew about trans, and certainly most people would have been completely unaware. So we've got Chaz Bono here, who is Cher's son, who's quite well known as well. And then we've got Aidan Dowling, who is a YouTuber who documented their transition on YouTube. Some of you might be aware of. So yeah, these are real people. So moving on to the interviewees. So I thought I'd just read out this quote from Jameson Green from his book, Becoming a Visible Man. And he's quite well known. His book, I think it was first published in 2004, but I've got his book here. He's quite, it's worth reading. It has a lot to say about what it's really like to navigate coming out and all the challenges, and just actually what it's like to be out after you transition, which is another piece that people forget about. It's not all about the transition and the coming out. There's also this other piece now, increasingly, as people transition earlier, of just living, getting on with their lives and what that's like. And some of my slides later on talk about that, some of the challenges that come up. So he says, just like anyone else, when trans people lie down at night and shut our eyes, helpless in sleep and vulnerable as infants, whether we have someone's arms around us or whether we are all alone, we know that all we have to live for is to be the best version of our most authentic self that we can possibly be. I thought that was really beautiful and very heartfelt, and so human. So with that in mind, I just thought I'd introduce the interviewees that I spoke to in my research. And later on, I've got just some quotes from them which illustrate various themes. So we've got Edward, who's 46 years. He identifies as heterosexual. He's single, white British, began transitioning quite early in 1999, and he's had all the surgery, the top surgery, the phalloplasty, all the hormones, everything. All of these people now are living completely as men, and don't really even often consider themselves part of the trans community in an active sense. So Tom is 49, bisexual, long-term female partner, white British. I began transitioning in 2018, and is at the first stage of phalloplasty. And he paid for some of this himself as he's doing it later in life. He's got more resources. He also has twin girls, so from a marriage. So this is where we start to get a picture of, okay, this is all quite rich and can be quite complicated to navigate. How do you tell your twin girls that you're going to transition? And this came up in the interviews, actually. It's not just about what the person themselves wants, it's how they navigate that within, say, their roles of mother, or wife or sister. All of that is important. And so now we've got Charlie, who's 65 and heterosexual, married, white British, began transition in 2004, full phalloplasty surgery. Again, so Charlie was very lived as a lesbian for a long time, and was very much part of that community. And all of the participants followed a similar path of trying to fit the sort of normative model, having boyfriends. Some got engaged, then coming out as lesbian, and then at various points then transitioning across and coming out. But there seems to be a path that a lot of people follow. Yeah, Charlie also married and had a child. And Brad also had a child. Brad's 45, heterosexual, had been in a long relationship, but then that ended when he came out. So there's a story with each of these of often being with a partner and how that is to be supported through surgery, or to tell your parents that you're transitioning, or having a relationship end because you've decided to transition, or having a supportive partner who just can't quite make the leap to you now presenting as male. So these are all real issues that have been navigated. So when I interviewed each of them, there was a sort of core relational message that came up with each of them. So with Edward, it was help me. And Edward was quite interesting because he'd had quite a difficult childhood with abuse and violence and all sorts of things like that. It was very much a case of being ostracized by family, that kind of thing. So this was really the core message for Edward. With Tom, it was more raised by quite authoritarian parents, very middle of the road, very conservative. So it was, what about everybody else? What will my parents think? What will society think of me? With Charlie, it was, I can't put myself first, because they were so worried about how their children would be affected, and waiting till they were 18 until they actually decided to transition. And then with Brad, it was, I was a man all along. So Brad was quite interesting because very kind of matter of fact male approach, just I decided, I realized, and then it was just a case of getting on with it, and I was a man all along. So that was it was quite interesting and illuminating to see how there are four very different stories here, all under the umbrella of I'm a trans man, but actually lots of different factors going on here in the family system, personally, to do with personality and an upbringing as well. So then in terms of main themes, there was a sort of natural progression from the inner world, the personal realm of being a child, not fitting in. So telling their parents, but I'm a boy, being a tomboy as a child, being the girl who didn't fit in. He didn't want to go to the girly parties and dress up and wear the dress that their mum had bought them, all this kind of stuff, with lots of external input trying to push them into being female and sort of expressing that. in quite stereotypical ways. And bear in mind, this was often in the 70s or 80s as well. Things like having to wear a bra, even awful experiences of their first period being really traumatic, being pushed into this sort of pink world because they were a daughter. So of course you've got to wear makeup, all of that. So there's this real dissonance that started to emerge through the interviews around what it was like to grow up female but know something wasn't quite right, or even say I'm a boy but being told, well, actually you've just got to get on with this, you're not a boy, you're a girl, so you know you can't go around with your top off just running around with boys because girls don't do that. All this kind of stuff comes in, the social conditioning. And then this aspect of truth. So all of them at various points reach this moment where they just sort of crack and they decide to stop trying. And they just sort of give up and sort of try and fit in. So things like having the boyfriend, sort of giving up the sort of impulse to say I'm a boy, trying to have a boyfriend, going to the teenage disco, where talking about bands, wondering why girls are whispering and having lots of girly crushes and not really understanding that, but not quite going to the teenage disco and feeling really awkward because all the girls are on one side and all the boys are on the other side and they don't feel they fit with either. Having had male friends who then won't talk to them because now they're a girl and they're going through puberty and it's just a bit more awkward. All this sort of stuff was brought up and was real. But then there's this point of this light bulb moment, this truth, where they suddenly realize, oh my goodness, this is me. I am this, I am trans. And they, all of them, interestingly, described it as a light bulb moment, like a light bulb goes on in their mind and suddenly it makes sense. So this was really interesting for me because they all reached it at different ages and through different routes, but it happened nevertheless. And then we get to this place of the pain and the dysphoria and the confusion. So there's this aspect of they hated puberty. That was awful. Imagine growing breasts, imagine being quite busty if you feel you're male. Some of them were quite busty and had quite big female figures. That was really difficult. Imagine trying to do sport and just hating that. The showers, the girls all having a shower together. All of these things were talked about as being really challenging. And then the dysphoria that comes with that. I couldn't even have a bath. So when they realize that they're transgender, suddenly they're actually realizing, oh my goodness, my body does not fit with how I feel. And I might be able to go out and look the part, but when I'm at home privately, I'm not. And this manifested itself in varying ways with the different interviewees. Some of them, one developed an eating disorder, which they then realized was to do with trying to reduce the curves. So if I don't eat, I'll be slimmer, therefore I won't be curvy. One of them had really bad dysphoria and literally used to mutilate and self-harm to try and sort of, they just didn't feel that their breasts were part of them. So it varied, but it was there. And so then there's this sort of aspect of then in the physical, having the mastectomy and the freedom that comes with that, having the phalloplasty, moving more into a place of alignment, and then moving across into they're no longer hiding. There's this period where they said, well, one of them termed it, I'm neither Arthur nor Martha, and I'll come back to that later on. But there's this period where they're not really one or the other. They're not really passing, but they're definitely not looking so female anymore, and it's kind of not quite, their voice is dropping, they've got facial hair, all that sort of thing. They've ditched all the female products, they've ditched all the female underwear, blah blah blah, but it's not quite there. And all of a sudden there's this moment where someone calls them he, or on the phone assumes they're male, and the delight and the joy of this, but alongside that, family saying you're dead to me, So all of this stuff coming out and being visible has consequences. It means you're passing now, but maybe your family won't talk to you, or maybe you suddenly realize, I have no idea how to be a man, actually, because I haven't had this rite of passage of adolescence where I learn on the job, as it were. I haven't tried out being in a relationship in this way. And I'll come back to this later, this theme of how they actually then fit in. So there's a sort of natural thematic flow that seemed to come forward around starting with the personal and the spatial element, but I'm a boy, and then moving across into this sort of lonely place, which is temporal, which is about coming into awareness. And then the realization, the light bulb moment, and the physical changes that go with actually taking the hormones, having the surgery. This is all very much in the place of embodiment. And then the becoming whole and the social and relational aspects of that. So it moves across the dimensions quite beautifully for me. So in terms of stages of integration, there seem to be 5. One is the realization. Then there's the rejection of who you were for who you are, the leaving behind. And this can sometimes be really challenging because you get this splitting. So one of the challenges with therapy is to help the person to come to terms with who they were and maybe have more compassion for that person, rather than often what happens is they just deny that and put it in a box and even sort of hate that person, and it can be really a source of issues. So there's that. Then there's that, well, who am I? Do I pass? Who am I? Who am I? Who am I going to be? Choosing a new name. What sort of dress sense do I like? How do I do this? And then this physical and emotional acceptance, and then the integration of who you were, who you are, and all these elements of gender and sex, that often this brings with it questioning of your sexuality. Am I actually attracted to women or men, or both? How does that work? Because the hormones as well can have quite a big effect on all of that. Just looking at some of the next few slides are just some extracts from the interviews, just to give you a greater insight into some of the experiences of the interviews at a deeper level. This is Edward. I never chose to be a girl, never accepted it. What I did was I just locked that part of me down because I realized I couldn't show it. I realized I couldn't be who I am. So as I grew older, when I went to school again, I was still a boy. I just looked silly in a skirt. So there's this aspect of, I know who I am, but I can't go anywhere with it. I can't express it because everything around me, my parents, school, everyone is saying you're a girl. So how do I make this work? And they find interesting ways in the interviews. They talk about things like, delighting in actually wearing, if their mother let them wear trousers, this was a huge deal. Or if they get to play karate with their brother, this is really important because actually it's an expression of their masculinity that they can't. So people who have brothers, so I think it was Tom who had a brother, he was able to access more toys that he would have liked to have had, whereas if you only had a sister, perhaps in the 70s, it was all Cindy's. So that was really challenging because there was nowhere to go with that. And it does sound quite stereotyped, but I think in those sort of times it was, it really was. So there's also this, you can't go around with your top off because you're reaching puberty and you're developing breasts. So you've got to wear a t-shirt, even though you might feel you're a boy. You can't do that because socially it's unacceptable. So yeah, all of this, being a tomboy, finding release. So a lot of the participants, the interview said, before puberty hit, I was actually okay because I could hang out with boys and I could climb trees and I could run around and it was all fine. But it was when puberty hit and the sort of girl boy thing started to really make itself known that I ran into trouble because I couldn't be me. I couldn't just be sort of asexual, as it were. I couldn't just be a person. I suddenly had to be really a girl or a boy or a burgeoning woman or a burgeoning man, and that became a problem. So they found outlets for self-expression, which were really quite sweet in a way. So this is Tom. He decided that because he couldn't express himself, his Cindy would never wear ballet clothes. His Cindy would never wear a dress. Cindy had a car and a horse and wore combat clothes from Action Man. And this sounds quite sort of, it's quite innocent and beautiful, but it's also quite sad in a way, because this is the only way that Tom could express his masculinity in his childhood at the time, was through his toys. So I think this is quite interesting, and actually a lot of the participants in interviews talked about this, how they used their toys as a way of expressing themselves when they couldn't do so in the real world. And so things like uniform. So Edward talked about taking huge pride, because always he had to wear a skirt and wear the female uniform, but could wear a tie. And this was something the boys also wore. So actually, I'm going to take huge pride in wearing my tie and perfecting it. It's going to be the best done tie ever. And this was a sort of display of masculinity. Even though he didn't necessarily realize this was quite what's going on, it was a sort of reaching for something that made sense. So they all find their own ways to move towards this. So then there's this rite of passage. So Brad talked about having been a bridesmaid 5 times. Can you imagine? Which he absolutely hated, having to wear the big frilly dress, all of that. Everyone's very excited, having a big sister who wants to make you up and show you how to be a girl or a young woman, and absolutely that's not happening. And so Brad said, my parents weren't that bad, and they let me have a police bike and a helmet. And this was delighted in. There was a real sort of almost rebellion in his voice when he told me this. But then other family members, sort of lots of female cousins, trying to sort of get him to one side and show him how to use a makeup brush and all of this. These are sort of fleeting moments, but they're really burnt into the memories of my interviews, because they actually are another step down a road that they don't want to take. It's another step towards that dissonance that says you're not male, you're not a man, you're going to conform, you're going to do this. And then, so boys and men, this was quite poignant, because you've had this carefree, often tomboyish child who knows something isn't right, who then goes through adolescence, and then relationships rear their head and sexuality rears its head. And all of the participants talked about trying to have a relationship with a man or another boy, and trying to make it work, and it just didn't, and they couldn't understand why. 2 of them even got engaged, and it was just the pain that caused for them, and also for their partners as well. They're talking about lying back and thinking of England because it made everything easier. So this is where it gets quite poignant and potentially quite painful, because this is where people are allowing things to happen to them in order to conform, and this stuff is carried through then in their lives, and it's not exactly rape, but it's not far off in some cases, and that's really difficult. That these are personal experiences that people are going through, in a very confused place, trying to conform, and then giving up themselves, giving up something of themselves in order to conform sexually, which I found really, really hard to hear, actually, in some ways. It was really hard. So then Charlie decides, well, I'm going to go into complete denial. So he decides he'll marry the most eligible person in the area. And he gets married and has 2 children. And he says, this is my gay phase. So he can rationalize it by saying, this is my gay phase. And then, and so Tom is the same. So Tom is very much trying to get engaged with this guy, gets an engagement ring, it's all happening, and then they just can't go through with it. But then in Tom's case, he, as I recall it correctly, he was on the contraceptive pill. His parents found out, his mother was horrified, he got thrown out of the house. So he had to stay with the partner because he didn't have anywhere to go. So that perpetuated this living a false life. So there's lots of stuff here that gets very mixed up and difficult as these people move into young adulthood and what they're sort of doing and making themselves do. So this is the light bulb moment. This is where the interviews talked about realizing what was going on. And so often it was with a partner, something wasn't working. So maybe sexually it wasn't working properly, or there was just something not right. With Brad, he was having a big row with his partner, and she just said, you know, maybe you're a man, maybe you should just be a bloke. And he just was like, oh my gosh, actually yes, that fits. And it suddenly, and from then on there was no looking back. And then with Edward, it just like a switch went on, and suddenly it allowed me to live. So this is this sense of bad faith of actually I'm living, but I'm not living. I'm going through the motions, I'm wearing the clothes, I'm putting the makeup on, but it's not me. And you can get totally lost in that, and people did for years. So that was really coming through quite strongly. But so then we look at, so we've got the referral rates, which you've seen, and the waiting times, but now a lot of people just do it themselves. So they either pay for surgery or they can get hormones on the internet. They can go to, there's some private companies that will offer support. So people are increasingly taking matters into their own hands. And Brad was an example. He said, I just researched it, I looked at what it was, and then I just injected it in my leg. And that was, it just sounds, but that's what happened. Yeah, you'll have to do 6 months before you even speak to someone. Then you'll probably have to do 2 or 3 years living in role. This was what the gender identity clinic said. So what did he do? Just goes and does it himself. So this is actually quite risky potentially for people, because they're doing some serious things to their bodies, but without maybe clinical medical support. But they're going for it, and there are lots of forums now which will offer information, and they can access that. So it may not be perfect or right necessarily, or help or safe, but it is what's happening. And I think it's happening more and more because of the waiting list being so long. So then moving on to the pain dysphoria and the confusion that can happen. So this is where it's not always enough to have the hormone therapy. Sometimes they want to go further. So some people just stop with hormone therapy. Some people have the mastectomy. Some people have the full phalloplasty. So Brad said, I was cursed, I was large chested, so they took 2.2 kilograms off me. It was quite interesting to me when they all four of the interviewees talked. They were very matter of fact. So they had no sort of concept of their breasts being part of them. They were just sort of lopped off or removed, or they were the first to go. These are the sorts of phrases. So there's a real sort of, I'm a man and I've got these things on me. It's not, and so they might spend a lot of time having binders, for example, to hide their breasts, and that can be really painful. So these are the sorts of things that are going on behind the scenes as they go through transition. So Edward had an experience. He went to a gender identity clinic much earlier on and was told that you can't be transgender because you're not female. So this is an example where they didn't even realize that you could be a trans man. You could only go one way, you couldn't go the other. So this gives a sort of an insight into how much things have changed over the years, the last few years in particular, particularly with the internet being available, and a lot of forums and chat forums and support. And these are just some just sort of images of, got the Tavistock Centre on the right, which is where people typically go. There's Gender Care, which is a private UK company that can support people's transition. But then there's also lots of internet based support where people go through it together and they post what's going on for them as well, and that can be really supportive. So just to give you an insight into what actually happens, which again, I mean, the reality of this is quite eye-opening, is if you start transition, you get acne everywhere, you get a sore throat because your voice is about to break, your periods become really all over the place, a bit like maybe going into menopause, you get flooding, you get the hot flushes, you get all of it. So it's a bit like you're having the menopause and you're transitioning your gender as well. So it's lots of stuff going on, lots of emotion. They mentioned, so Brad mentioned crying at the drop of a hat. So lots of emotion. This is where support, therapeutic support, could be really helpful, just to say it's okay and we understand what's going on here. Yeah, it will pass, because this can be very confusing, because how do you know this is where you're heading is where you should be heading, because you don't know until you actually arrive there. So you're sort of setting out on this path and suddenly your body's going crazy and everything about you that you knew is shifting. And this was certainly something that I hadn't fully appreciated before the interviews. So then we've got this in-between stage. So you're one thing, but you're sort of like half of one, half of the other. So you can maybe pass when you're out, but when you take your clothes off, you're you, and you've got this shame because you're not fully there. And you have your first testosterone injection and you do all the stuff, you have your haircut, blah, 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 but it doesn't just happen overnight. So this thing that you desperately want, that you've maybe known is there for a long time, and you finally had the courage to do, actually isn't something that happens immediately. It takes time. And it's subtle, and that takes courage as well to persist with. So this is another area where I think therapeutic support could be really helpful. And then we've got the phalloplasty, which is, it's expensive. It's a 15-hour operation. It's painful. This is on the right. This is what gets put in to create the penis, and then you have this big skin graft on your. This is one of the options: a big skin graft on your arm. It's not for the faint-hearted. Often, so all of the interviewees who'd gone through this had complications, difficulties, infection, things like the pump breaking and having to have the whole thing redone. It's not an easy thing, but people still they want it because it makes them feel complete. And then, so we're moving towards the sort of final slides now. We've got the social transition. So you've done all of this, but then you're like a bit like a teenage boy, but you're maybe 30 or 40 or 60, and you haven't done all of this stuff. So one of the big things that came up with everybody was, how do you go to the loo? Where do you go? So you could go into the urinal. What do you do? What's the etiquette? How does that work? Or you ask someone out, and at some point you've got to tell them your history and risk rejection, and that's a really a big issue a lot of the time. Just if, so Brad said, and it was quite humbling to hear him say it, he said, well, I when I have my last surgery, I don't know if I'll be any good at it, because everybody else has probably tried out everything in their teens and their 20s, whatever, and I'm now coming to this sort of new, and I don't know how to do it. So you need a very caring, loving partnership to explore this kind of thing. And again, this is the sort of thing that is difficult to talk about, but could come up in therapy, and could be a source of support for somebody who's really trying to kind of come to terms with, how do I actually do this? And just also exploring sexuality. So, I thought I was lesbian, now I've transitioned, am I still lesbian? Do I like men? How does this work? What does this mean for me sexually? Came up a lot. And again, this is the sort of thing that could be hard to talk about, but we need to be aware of that it's going to perhaps come up in the therapy room, because this is the real nitty-gritty of actually what does this mean for me now I've transitioned? How am I going to navigate myself in the world? And this is one of the final pieces of having made the transition, of actually having a meaningful life, having relationships, making things work going forwards, is actually understanding how transition has impacted sexuality and what that means. And luckily there's a lot more information again out there now than there ever was, certainly not in the 70s and 80s, when a lot of the people I interviewed were transitioning on their own with no information. Imagine with no internet going through all of this, quite a big deal. So then we get to this point of, yeah, no longer hiding. So you've gone through the transition, you've taken the hormones, you've had the surgery, you've started dressing as male, you've changed your name, blah, blah, blah. And I just thought I'd sort of move to close with just these images of people who've transitioned more recently, and they're all much younger. People who are, so we've got on the left is Elliot Fletcher, who's an American actor. And then Elliot Page is next, who's a Canadian actor who came out, I think, last year, and was quite well known as female before that. So these are people who are out there, they're living it, they're doing it, it's happening, and they're thriving. And this is increasingly, I think, where things are at. Which is really exciting. So the next person along is Brian Smith, who's an award-winning actor. And then the last one is Kai Allams, who is the first openly transgender NCAA division college athlete. So that's, again, really exciting. So people are transitioning and finding fulfillment in all walks of life now, in all sorts of careers. And they're not hiding. So this is why I really thought this would be a great example of a pathway to empowerment, because it really is, in a way that actually I think it would be hard to find another way in the human experience, that we move quite so profoundly into a different way of being that is all about living authentically, and this is a great example. So this pathway to wholeness, I thought I'd just illustrate it this way in my final slide. So at the beginning, in the center, we had this not fitting in and having no choice, knowing maybe that I'm a boy, but it being denied. So this is the personal dimension, the inner knowing. And then this moving outwards into this truth of, oh my God, I am. This is more the temporal, the moving, the sort of emergence that in Emmy's quote that she talks of, and then moving out further, this corporeal, this lonely, long distance runner aspect of this is it's not a sprint, this is quite a long process of transition, and it's very physical, it's very embodied, it's all about surgeries and physical changes and passing and changing everything about you physically in order to pass and fit in. But then that leads then to this sort of blossoming wholeness of I'm no longer hiding, I'm becoming whole, I'm integrating with the external world in the social dimension, through my masculinity, through my sexuality, in my family system, in my interpersonal relationships. So that's my final slide. I think we've got 4 minutes before it's 8 o'clock. So yeah, that's everything I wanted to say. Yeah, I think
wonderful.
Hand back to you.
Wonderful. Thanks so much,
Thank
Annie.
you.
That was just so much there for us to think about. I mean, it's so many different elements that you brought. I think we're hoping that your colleague John will join us. I don't think they're with us yet. I have just sent you another link, Annie, in case you want to forward it to him.
He may not have the passcode
to go. Yes, I've just sent that through to you, so hopefully you can forward that to them. But whilst Annie and I do a little bit of admin, if anyone has any questions or any comments that they would like to put to Annie, either you can pop it in the chat and I will read them out, or you can just pop your hand up and ask Annie directly if you would like to. So I shall give everyone a few moments in case there's anything that you'd like to reflect. Aha, I see John has just joined us. That's wonderful. Hey, John. Fantastic. Thanks so much.
Hello.
Annie, do you want to introduce John whilst I do a little admin? That'd be great. Thanks.
So I've known John for quite a number of years, and yeah, he runs a private practice called Transgender Therapy, specifically supporting trans people. Does work with other people as well, but it's international, so he's worked with people all over the world, in America, lots of parts of Europe, I think other areas, Saudi Arabia, and he himself is trans. He transitioned, I think, when was it? It was quite a while ago now, wasn't it? So yeah, so he's very kindly said that he would join us today to give a sort of personal view and take some questions. So thank you very much.
Thank you, Annie.
That's wonderful. Thanks so much, John. Just a few kind of admin bits. People asking if they can grab your slides, but also where your research may be found, Annie.
Okay.
So
Sure.
what if you're happy, what we can do is I can gather that information, email it around later on for anyone who wants to hunt out Annie's research.
Sure.
I mean, one of the things that struck me really listening to what you were saying, Annie, is kind of how much, you know, how much trauma, I suppose, individuals go through, and from kind of the everyday becoming or being traumatic in a sense that other people aren't necessarily viewing what's going on as being deeply distressing, but for the individual themselves, even from when they're really young, what they're experiencing is just acutely difficult and traumatic in the way that we would use the definition of the term, in terms of kind of feeling life extinguishing. That really struck me from what you said.
Yeah, absolutely. And I think there's a really that aspect of denial of self, that there's this kernel of knowing that all of the interviewees talk of, but actually it's denied and suppressed through their interactions with, say, family or school, which then leads to a sort of giving up often, which makes it then, makes the process of coming out longer, because then there's this sort of self-doubt that becomes rooted. Would you agree, John?
Yes, very much so. And they basically end up becoming, or thinking they have become, the identity, which is projection. And when they do come out and actually realize that that isn't them, quite often that then develops into imposter syndrome, because they're so used to being something that's not themselves to please somebody else, that they then, when they actually are them true selves, feel that they're an imposter. It's very difficult to get beyond this, because naturally that's what they do. So trying to find their authentic selves, them trying to find it, and you actually talking to them as a therapist to their authentic selves is very difficult, because they're so used to being able to morph to what they think you want.
That's really interesting, and something for us to think about when we're working with individuals, for sure. Just had one question come through on the chat. A couple of questions coming through on the chat. People, great. Please keep them coming. So one here from Fergus, saying, you haven't said much about the selection process for the interviewees. Given that only around 3% of trans men opt for phalloplasty, was it an intentional choice to only interview people who've opted for this kind of gender confirmation medical intervention? Is there anything that you feel you may have missed by working with this specific part of the trans male community?
Yeah, it's a great question. So when I was looking for the interviewees, it was really, the starting criteria were that they had to have been living as male for at least a year and had a referral to a gender identity clinic and anything from that point. So there wasn't a stipulation that you have to have had a phalloplasty or whatever. It was just that was how it happened with those particular interviewees. In terms of, has that meant I've missed anything? I don't think so, because in that process that leads to phalloplasty is typically one of the last pieces of the jigsaw. So in that we have, we've still got the coming out phase, the testosterone therapy and what that means, all of the impact around the interpersonal relationships and family of that, and the mastectomy, which is far more common. So I think a lot of it is covered in that, in the general themes. Also, because I was opting for a lived experience method, I wanted to go deep rather than broad. So it really been interesting to have interviewed people with slightly different experiences. For example, there's nobody there who is from a different ethnicity or is identifying as gay. That would have been really interesting. But there's no reason why that couldn't be specifically the focus of other research in the future. Yeah.
Fantastic. So we've got another question here that's come from Cameron. Hi, Annie. What a wonderful talk. So glad that you were selected to present, as this is such a relevant topic on so many fronts. As someone who works with young people, I'm often impressed by the drive they exhibit at such a young age to live authentically and to identify as trans. My own child, who was born a female, has identified as a boy since the age of 12 and changed their name to a boy's name. I confess I found this a challenge to discuss with them. Do you feel there is an age which is too young for parents, therapists, teachers to discuss openly with a young person or child?
So from my own experience, having a child who's more recently come out, I think it's very important that it comes from the child. Because they're forming their sense of self, it would be potentially possible to influence somebody or to suppress what was going on for them through the wrong approach. And certainly, I think you'd have to think very carefully about the type of external, say, therapist that you introduced to your child because of their young age. I think for me, and I'm sure John has a view on this too, but certainly being as open as possible, as supportive as possible, not going with the stereotypes, allowing all options to be on the table, allows that child to then express themselves without feeling they've got to conform to a particular mold. Because a lot of the time in the research I did, the issue came from the parents and often the mother, because it's a daughter effectively. For trans men, they have a daughter. They want that daughter to grow up a certain way, wear certain clothes, be a certain way, do ballet, do horse riding, all sorts of things which the mother may have projected onto the child. So if it's possible to actually strip off those stereotypes and just be with the child as they emerge, I've certainly found that that's helped with my relationship with my child.
John, did you have anything that you wanted to add in?
I think it's yes, sometimes when somebody says that they think they could be transgender, or they're debating their gender when they're very young, I think you could find that you could impregnate more to that idea as a parent, because you want to be supportive. I think to actually go with the flow and not push one way or the other is the best way. Children develop in different stages nowadays. There's a lot more choice than there ever used to be when I grew up. And to actually just sort of like, okay, so what does that mean to you? How do you want to present yourself? What do you want to be called? How do you want to feel this through is important. Not to suddenly go, oh gosh, you must be transgender, must go and get a therapist. Or the other way, go, don't be silly. Those two extremes can really damage the child. But to actually just say, okay, then let's explore this together, they could grow out of it, or they could find that they actually, yes, they really do feel that that's their gender. Therefore, as they get older, let's look at it more seriously. And what can we actually do to support you as you go through your puberty to actually make it as easy as possible for you? I think a parent should be very neutral if they can possibly be. Yes, I understand that it can cause quite a lot of grief in a parent if they suddenly find that their child is changing their gender. It almost feels like they've lost a child. But to try and maintain that neutrality and being aware of you are the guardian, you're the one that has the common knowledge, the sense, you're the grown up. So, you're there to guide them, not to put your emotions onto them. And to be very well aware of, yeah, you have a right to your feelings, but don't put it on the child, and allow the child to grow up in as neutral as possible, so that they're actually not being pressurized to be one thing or the other.
And can I also just add as well that there's the same sort of this black and white thinking of you're this or that, but actually sometimes that can become such a focus that the child themselves, the whole child, gets lost and actually the whole family becomes focused on it in a way that's not healthy. So, you know, let's focus on the child's interests outside of that, or, you know, maybe they have they need to develop their friendships more, or, you know, all that sort of stuff can get lost in the focus of the binary trans or not trans sort of debate. And that can be a bit of a tunnel as well. So for a child that's perhaps already feeling some anxiety, it's good to keep the options open and take the pressure off.
I totally agree with
Yeah.
you, Annie, there, because one of the first things that I do when I'm giving therapy to somebody is to do normalization. And to take the hang up out of the fact that they could or could not be trans, that they're identifying as gender queer, whatever that is to them. The main thing is to actually, well, what is your identity beyond the gender? And as you go from there, the gender just naturally becomes what it needs to become, rather than making it the focus and the prominent aspect, which then causes a lot of anxiety. And that's the same with children. So if you can actually just switch it out. I mean, I know somebody that went to a local school here, and they were biologically male, but they identified as female. And I was there and spoke to the headmistress because she wanted some guidance, and I basically said, well, you know, what does the child want? What pronouns do they want, and how do they feel? So the boy, he saw himself as a boy, and he wanted to keep his male name, but he wanted to wear the female uniform. And so basically the school was going with what he felt. He wanted to go, and when he went up to senior school, he dropped it altogether and was quite comfortable being he in all the aspects. But the school and the parent let them be how they wanted to be, with no attachment, and they were just seen as gender queer. And the rest of the school understood that gender queer was something to do with actually questioning your gender, and that was no different to anybody else when they question anything else about themselves.
Fantastic. Thank you so much. I know Cameron has just shared that's great advice, so thank you. I'm really struck by how much often the anxiety is kind of in the people around the person who might be questioning their gender, particularly with younger people, maybe rather than just being with the individual themselves and being mindful of what's going on a systemic level. That really struck me there. Another question that has just come through from Graham. I'm wondering whether living through so many years of inauthenticity, not feeling like the real self, might create a vulnerability to trauma of various kinds. Do you think there is a high prevalence of trauma among trans people, perhaps because there are fewer supportive places to turn when negative life events occur?
From my perspective, I'd say definitely there's increased vulnerability in a number of areas. For example, in my interviews, all of the participants talked about having a sexual relationship with somebody that it didn't really work, it wasn't congruent, or they just did it for the sake of it, or they felt they were pressured and they couldn't say no. And there were sort of aspects of needing a home, or not having parental support because of being trans, being kicked out or not supported, meaning they were more vulnerable to manipulation. All these sorts of things sort of feed in. So they're not necessarily caused by being trans, but they're caused by maybe how society moves and shifts around that, how the family system accepts or doesn't accept the person who's identifying as transgender or whatever, how the family wider family accepts them or doesn't, say siblings. Also, if you're in a relationship, does that relationship then suddenly break down because you come out and suddenly, I've got one person I know who's lost their wife and their children as a result of coming out. So it's very real, and I think so there can be sexual trauma, there can be emotional trauma, there can be physical trauma. People can be assaulted because they're out and they're trying to present in the way they want to, and perhaps they encounter somebody who isn't okay with that. So there's lots of areas that are more risky as a result.
Fantastic. John, was there anything that you wanted to add in there?
Annie was really talking about trauma that you get when you're a teenager and above, really. But you can actually get trauma from the beginning of the age of 7. It's very sort of like noticeable that a lot of people that are trans start questioning at the age of 6 and 7. And you can get trauma from just being told, oh, you can't go outside with no shirt on anymore. You're a girl. You've got to put your shirt on. You've got to dress like this. And that causes distinct trauma. You know, I remember myself expecting my body organs to grow. They didn't. That caused a lot of trauma. Nobody could give me an answer. Nobody could take on board what I was saying. You know, I'm a boy, so where is the things that I should be having as a boy? So your trauma starts very, very early on with most people that are transgender. And then this just gets impacted. The more you sort of like try and push down what you're feeling, go, oh, I'm being silly, you push it down. And, you know, it's trauma on trauma on trauma as you go through life until actually, you know, you are recognized as being authentic self in the gender and the body with the gender when the two match. So yes, it just combines all the time, on layer, right the way from when you're about 6, 7.
So really, John, you're saying that you could have a specific event which could lead to, say, a PTSD kind of thing, being attacked, whatever, but then there's this more complex trauma that layers up over a lifetime.
For sure, definitely, Annie, because it's just the little things that happen to you as a kid. And the fact that you want to be authentic and you're something that's said by somebody that's like just an offhand comment to you is terrible. And you don't understand, because to you at that age, you are who you are. So why are you being told you can't present as who you are? And then you realize you have to put up and shut up and be what you think they want you to be. It's damaging from the first point.
It makes me think about your point earlier, John, around the kind of the difficulty in terms of finding one's kind of internal sense of self and how much that ends up being kind of, you know, pulled apart or squashed because of this kind of constant morphing, which you're doing from the age of 6, which is like when you're very, you know, you're only starting to kind of find yourself and you're already going into this process of becoming something else. I think it's, you know, it's highly so
is it any wonder that when you come out of trans, you're completely and utterly lost? You haven't got a clue, you know? You imagine losing your job, your house, your children, your wife, and your name and your gender. Well, what is left to identify as a person?
This is exactly why this topic is so interesting from the existential perspective as well, because of the loss of the falling away of all these knowns, these givens, and then what's left is the authentic self, which then emerges. But it's not easy. It's painful. It's difficult. Often it's very challenging, and so that's why, you know, often. It's hard won, isn't it? It's not a walk in the park. All of the people I interviewed had all had mental health issues, and it was all as a result of what we're describing, that sort of loss of self, loss of the locus of control, the ego boundaries falling away, just not knowing where do I have no anchor. I have no anchor, and I have to create that for myself. But that's not easy when you're maybe struggling with finances or paying rent, or suddenly you can't work or whatever. You're recovering from difficult surgery. All of these things are really hampering. Even benefits, which I didn't recognise trans people, and you know, say you suddenly you can't get support. All these things just make it that much harder.
And also, you know, if you have a propensity for OCD or cutting or addictive behavior, I mean, you know, this all comes into it as well. So you've not just got the trans element, you've got all the other things come up too. When I'm dealing with trans people, it's not just trans, you have everything else as well. And to me, there's some of the most complex people that I ever work with.
Yeah. Thank you so much. We've got some more time for questions, everyone. So keep your questions coming in if you've got any more, or you can raise your hand if you would like to just ask a question. But while I wait for you to put your questions in, I'm going to take the opportunity to ask one. I was thinking about the kind of the relationship with the body and how complex and often fraught that is. And I know, Annie, that kind of somatic work and embodied work is part of what you do. And I just wondered if in either Annie or John, you do any kind of body work or kind of within, when you're working with individuals of any kind or somatic work, whether that becomes part of the therapeutic in a relationship at all.
Yeah, I mean, from my perspective, it can be really useful because as with any sort of trauma work, it's often what's felt in the body, held in the body, which can't be named or verbalized. So it can be a great way of integrating parts which have been separated off. The sort of the little 7-year-old that's frozen in time, that had this difficult experience that maybe John's alluded to, but also things like if you've had surgery, making friends with that part, making sort of integrating that part in is really useful and important, or saying goodbye to parts that you've maybe, if you've had a mastectomy, and how does that, it's all sort of linked. But I think, well, for me, a lot of it is around the sort of trauma work that can be done with embodiment, and some of the somatic models like somatic experiencing, for example, can be really helpful because it means that you don't necessarily have to go back to the trauma. You're not re-traumatizing the person by making them relive and talk about everything that's happened. They can access that through the body and heal in a way which feels really safe and held. Yeah.
Thanks, Annie.
Yeah.
So basically, I do a lot of work with the person before they have the operations. I teach them to love the body part that they've got, because the body part you've got is going to be the body part that you want. And if you can't love it, and if you can't accept it as something to the form that you're going to have, then it doesn't heal as well. I also do a lot of work with body scanning. Being a hypnotherapist, the body scans can be unusual when I place them in hypnotherapy. One of the occasions that I had was we were looking at their dysphoria, and they said they had a big snake around their waist, and I said, well, what's this? What does the snake represent? And they said the snake was actually guarding them from their nether regions below the waist. But I said, well, is this helpful? And they said, no, the snake is too tight, but I don't want the snake to go. And it was about finding a way that they could represent what they were feeling and be in control of it. And we lessened off the snake a little bit, and then they were absolutely fine. And the dysphoria went down because they realized that the snake was guarding them. It was a part of them. And this was the way they displayed the rise and fall of the dysphoria within the body.
It's really fascinating. Thank you so much for sharing that. It gives us such a kind of just a little bit of an insight into some of the work that you're doing. Got another question that has just come through from Elvis. The embodied work you were mentioning before, you mentioned somatic experiencing, sounds really interesting, Annie. Do you have any examples of that work? And also really fascinating example, John. So I think Elvis might have been mentioning when you were talking about kind of the relationship with different body parts. I think, Elvis, if I'm wrong, let yourself be known and we can clarify further.
Yeah, no, that's right.
Oh, brilliant, great.
Well, so I mean, if you were interested in sort of learning more, then I would say go and look at the somatic experiencing and the training and the neuroaffective relational model, NARM. They're both really good modalities. So there's also a method which is a bit like EMDR, which you can do when you use it. You can use it online. So you might use a long sort of thing like this, and you move it across to get the sort of eye movement. But it means you can then go with the felt sense. So what's the emotion you're feeling, and then you go into that emotion, and they can then sort of name what's going on as you move this whatever it is, pendulum, whatever, very, very slowly across. And it's a way of integrating what we could call trauma. So that can be really helpful. That's probably a good example. But another one is just focusing in on a particular part of the body and getting people to name the emotion. And then feel that emotion, and sometimes you can have a big reaction, sometimes people cry or they feel a pain or something, whatever can happen. But it's very interesting because often they won't know how to verbally tell you what this is, but they can feel it. And I find that can be a really gentle way of working that's quite powerful.
Fantastic. Thank you so much. So we've still got a few more moments. So if anyone has any other questions, keep them coming in. I was just wondering, was interested in terms of the age range actually of your participants, Annie, and I was interested, as I don't know whether any of you work with older adults, older trans people, and what some of the kind of the difficulties that they may experience, or some of the ways of supporting them, kind of thinking about kind of life stages and what that means, and how those things can interlink to make it difficult if you're someone who's trans. I don't know if there's anything you could share with us about those issues.
What's older?
What's older? Good question. I suppose I'm thinking of in terms of the kind of protected characteristics. So we're looking at like 65 and over, which is very vague. I entirely agree. but kind of from an existential point of view, someone who's reaching that stage. Yeah.
Well, I mean, what I would say is that the older people are, the more likely they are to have maybe been in a marriage or have children, or elderly parents who really can't cope with what's going on, or all those sorts of things, or even have a body which is much more developed in their you know, in their gender, that means that they can't pass so easily. Whereas if you're transitioning at 20, 25, 27, perhaps your shoulders haven't, if you're going female to male, it's different. But perhaps if you're, so for my child, for example, they're worried that they're going male to female, that their shoulders are going to get too broad, that their feet are going to get too big, that their chin is going to, all these things. But if you're already 50, that's already happened, and that can be difficult in both ways round. Would you say, John, do you have any observations on that?
I think it's easier to go from female to male as far as passing. Doesn't matter what age you are, because actually, you know, excuse me, I got a bit of a frog in my throat. Because actually we all start as kind of like more feminine, and then the masculinization comes later. So if you're actually a female to start with biologically, then, you know, you have your breasts taken off, you stop your periods as soon as you have the testosterone, your shoulders will broaden out, your waist will get thinner, you lose your hair like I do. So actually it's a lot easier to transition whatever age you are, and you'll disappear under the radar and be passable. But if you're actually a male and you've had that testosterone in your sort of like teenage years, you can't go back and take your shoulders inwards, you can't grow your hair back. You know, you can grow breasts, but your actual physique is set very much like a male. So the older you are like that, it causes a lot more problems if you're going male to female. I've had a big range. I've had up to 69 is my oldest that I've had transitioning, down to 12 is my youngest client I've had. And each age range produces different problems, particularly different societal problems, different problems to do with where you're at in your life and how you perceive your life, and also what generation you've come from.
Thank you. Yeah, that's a really good reminder of thinking about what's going on for that individual and the kind of their cultural and societal settings. Just got time for a couple, or a question, and anything else that anyone else wants to raise. But what crossed my mind was, is there anything that we can do as therapists or coaches or anyone kind of supporting to make it easier for trans people in terms of kind of accessing us, or that kind of initial step of help seeking, I know, can be really problematic, and sometimes inadvertently we might be putting up signs or doing things that are just deeply unhelpful. And I suppose it just crossed my mind about if there's anything that we can do to actually make it easier for individuals when they first come to seek help, whatever, you know, in whatever capacity we might be doing that.
I mean, from my perspective, I think it's just actually, for example, on a website or on social media, just showing that you're a trans ally, because there is some concern. You know, is this person going to be gender critical? Am I going to be straying into this difficult arena that I really can't deal with? So just showing that is supportive. Maybe engaging with local communities and support groups is helpful, just to say I'm here without, you know, pushing the service, but actually saying I'm here. So I work for a local counselling service where I offer my services for a very, very low cost. So that's another great way of being available to people who can't pay the full rate but still need that support, and they have a young person's arm. So I see some people quite often through that route where you know, the typical therapist just like, I don't know what to do with this. So there's also room there for just greater awareness, greater training. Just read books, get books like this and just read it so you really know what's going on.
Fantastic. Thanks, Annie, so much. John, is there anything you wanted to add in there?
I think being LGBTQI friendly, going to prides, having pictures of you being around and being allies. Well, T is not really LGB, it's an add-on. Definitely, if you're trans, you do actually have the questioning about your sexuality, even though it's different. So to actually be an ally of all of you, all of them, and to show that you supporting with like tweets and things like that support things to do with LGBTQI, having comments about or blogs about being genderqueer and supporting somebody, or having somebody that's actually been to you that's genderqueer. And I think the main thing is not to get somebody that's trans go, ooh, trans, and you just latch onto that. That's the worst thing you can possibly do as a therapist, you know, because it's not about the trans, it's about the identity, not the trans, not the gender.
Fantastic. Thank you both so much. I mean, and personally for me, it's been such an excellent talk, and I found it so useful. So thank you so much for giving your time. I really appreciate it.